Welcome to Save a Life in 1 Hour, a first aid course taught by real paramedics. In this module, you'll learn how to treat a patient who is suffering from burns. As a paramedic, I have attended many patients who have suffered from burns. In this module, I'm going to teach you how to recognise the different types of burns and also the best way to treat the burns. There are three main types of burns, known as superficial, partial and full thickness. The most common type of burn you'll see is a superficial burn. It involves the top layer of the skin, the epidermis. Note the redness to the burn area. The way that you can tell a patient has a partial thickness burn is note that there's quite severe redness to the burn. There's blistering and broken skin. The most severe burn you'll come across is called a full thickness burn. As the name implies, it involves all three layers of the skin, the epidermis, the dermis and the hypodermis. The way you can tell a patient has a full thickness burn is the burn itself will be black and charred or might be white and pasty. It'll be extremely red around the burn area. The reason that the burn is not going to be that painful is because all of the nerves have been burnt away. Full thickness burns are life-threatening because the patient loses significant amounts of fluid. So what do we do for a patient who has been burnt? Well, as always, we need to follow our 7-step action plan, DRS, ABCD. D in particular is important. If a patient is inside a burning building, never run into the burning building. If the patient is still on fire, you need to get them to stop, drop to the ground and roll around. We're trying to smother the flames. The first active treatment that we do is to cool the burn under cold running water continuously for 20 minutes. After cooling the burn for 20 minutes, if you have access to cling wrap, you need to place it over the burn. The way that we do this is lengthways. We don't place the cling wrap around sideways like you would bandage. The reason for this is burns swell. So we place it lengthways. There are three reasons that we place cling wrap over a burn. The first one is to protect the burn from infection. Next, cling wrap actually reduces the amount of fluid lost from the burn. And the last reason is to protect the patient from pain from the burn. Remember that the nerve endings are exposed. If you were to blow wind over those nerve endings, it would be extremely painful. By placing cling wrap over the burn, we protect the burn from the external environment. Any patient that has been in a fire has most probably been exposed to smoke. Inhaling smoke can be very dangerous, especially a few hours after the initial exposure. One indication that a patient has been exposed to smoke is black soot around the nose and mouth. If we look at our patient here, he has black soot around his nostrils and around his mouth, meaning that he most probably has inhaled smoke. When you're treating a patient who has a burn to their eye, you need to ensure that the affected eye is down. If the affected eye was up and you were to irrigate from the top down, there is a high chance that you'll contaminate the unaffected eye. So what we need to do is to cool the patient's eye using... So what we need to do is to irrigate the eye using cool running water for 20 minutes. Ask the patient to tilt their head back. Assist holding their eye open with your finger. And pour the water into the eyeball. Aim for the white part of their eye, or even the bridge of their nose so it runs into their eye. In some parts of the world, acid burns are common. If you have a patient who has suffered an acid burn, you must take them directly to the closest water source and flush that burn for 20 minutes.